After a total joint replacement, a lot of our surgeons will go ahead and have you use either a TED hose or a compression stocking to help manage your swelling and decrease your blood clots. To do that, you end up getting the TED hose, and then to put it on, I like to actually make a sock puppet and say, "Hi, how are you?" And then I take it with my thumb and my finger, and I flip the stocking inside out on the top. And then the foot component stays right side. And then there's a little bit of a difference in the heel weave, so you can kind of see the line, so I'm turned down to the heel. I'm going to keep the layers of the stocking single, but overlap the foot. And then we're going to pull open. We're going to go ahead and put onto the foot. We've already put a little bit of powder on Eric's feet to make the stocking go on a little bit easier. Standard baby powder is fine, or something like a Gold Bond or something like that will work as well. Then I'm going to take this and I'm going to bunch it up just a little bit to get it over the foot. Then I'm going to bring it as high up as I can get it. I'm going to bring it down a little bit so I can get some purchase on the stocking. And then I'm going to push up a little bit. And then you just kind of work the wrinkles out so that it's nice and smooth. We want to avoid those wrinkles down at the ankle because those get really uncomfortable and can actually block off the fluid flow and cause swelling between the wrinkles. So swelling can happen between the wrinkles. So the next thing I'm going to have you do, for me this has worked in the clinic a lot, is I'll end up taking and positioning the foot in my belly, because then they don't have to hold their leg up and you can shimmy up. The other thing you can do is you could place a pillow, or if you're flexible enough as the caregiver, you can bring your leg up and get into a position or put it on a footstool, because your loved one won't be able to hold their leg up as you go ahead and pull it up a lot of times after their joint surgery. And then you try to get this top piece as high up onto the leg as you can so that it's not rolling down or digging in too much. To take your stocking off, one of the ways to do that is to take it from the top and roll it down as 2 layers. The problem becomes if you bunch it up, it'll feel like it's about 5 times the pressure of what it is if you take it as a single layer. Once you get down to the heel, you can take either your dressing stick or you can go ahead and take your fingers and grab and take it off the end. And then you just pull it off. And then if you turn it this way to keep it as that single layer doubled on top of itself, then it's ready to be put on again. To help manage your swelling and to help prevent blood clots, a lot of times our surgeons will use an ACE wrap. You'll have to take that off on a daily basis to make sure that you can clean your leg. So to do that, to reapply the ACE bandage, what people do is you can start at the foot if it's more comfortable, and you're going to do that Velcro up, and then you're going to go ahead, and I like to put the foot in my stomach. Other people may put it on a supported pillow or on a footrest so that you can have access to it. And then I'm just going to overlap about a half and just unroll it. My trick to make sure that the tension is right is when I unroll the ACE wrap, I actually put a little tension on it so I don't have to pull a lot when I'm putting it on. If it is pulled too tight, what will happen is it'll be uncomfortable. And you may have to reapply the ACE wrap during the day because it does have the tendency to slide down. We're going to put one more because most of these ACE wraps are going to go well above the joint that you had the surgery on. And we're going to overlap over the Velcro again. And that top one I do pull a tiny bit snug, but not very much because we don't want to cause it to be too tight. And then we want that Velcro so you have easy access, and then just make sure that the Velcro isn't touching the skin or poking you. To take the ACE wrap off, I like to go ahead and undo the Velcro. I'm going to do one loop. And then the way I like to go ahead and roll it up is I roll it up on top of itself so that it's all ready to go the next time. And so as I'm rolling it, I'm keeping a little bit of tension on it the whole time. If you have questions about your use of your compression garment or your ACE wrap, you can ask your doctor or refer back to the booklet.